Thanks for taking the time to watch this video. I feel very lucky to be able to take care of sick and injured kids. I can't think of a more rewarding, challenging, sometimes heartbreaking, and often hilarious job than what we do. This video is about patient experience. Patient experience is sometimes used synonymously with patient satisfaction, but it's much more than that. The Society of Hospital Medicine defines patient experience to be everything we say and do that affects our patients' thoughts, feelings, and well-being. Some people wonder why it isn't enough to just do the right tests and give the right medicines. Those things are important, but I hope to show you why they're not enough. If you think back to when you chose to go into healthcare, it probably wasn't just the pharmacology and physiology that drew you in. Most of us went into this field because we want to take care of people. We want to help them feel better. That alone is a really good reason to focus on their experience. We want to help people. There are other reasons too. Patients who have good experiences are less likely to sue for malpractice. We all know there is a high risk of burnout in medicine. When providers are burnt out, they are less able to provide a good experience for their patients. But the opposite is also true. When providers get empathy training and patient experience improves, the providers also get more out of the experience and burnout rates improve. Treating patients with empathy improves both patient and provider experience. Another reason to care about patient experience is that patients with a better experience often have better health outcomes. They are more likely to follow advice and treatment plans. One study even showed a correlation between hemoglobin A1C levels and patient experience. Departments and hospitals that focus on patient experience have better reputations, and it feels good to have the community feel like we're the best there is. And finally, making sure all of our patients have a good experience is just the right thing to do. Which of these providers would you rather have take care of you or your family member? Improving patient experience comes easily to some. For others, it's less intuitive. When we're tired and stressed, it's more challenging. So after lots of reading and research, I came up with this mnemonic. They're very basic and most will seem funny and obvious, but I hope they can be helpful. I is for 3 different things. Introduce yourself, show them your eye teeth, so smile, and notice their eye color. Look in their eyes close enough that you can tell what color they are. This may all seem obvious, but it can actually be challenging sometimes in our stressful environment. So when you're worried about your sick baby or your hurt teenager, it might not feel great to be welcomed like this.
Hi guys, come on in, take a seat. What's the patient's date of birth?
Date of birth?
Date of birth?
And what's his date of birth?
It might feel awkward and fake, but if you can give a warm greeting, it really can help put patients at ease, like this.
Hi, my name is Mollis. I'm one of the nurses here, and I'm going to get you started today.
Hi guys, I'm Sue, I'm one of the nurses here. Take a seat. I'm going to check you in and we're going to get some vital signs. What's the patient's date of birth?
Here are some more examples of really nice introductions with great eye contact and nice smiles.
Hi, how are you today? My name's Megan, I'm one of the nurses. Hi there, my name's Mallory. I'm one of the child life specialists here in the ER. I'm here to help answer any questions you may have about the hospital and also provide developmentally appropriate play.
I just came in to see what brought you in today.
What brings you in today?
What seems to be the trouble today?
So I is for introduce, eye teeth, and eye color. C is for communicate. Communicate what to expect and give updates, like this.
Hi, the team just got called into the trauma room. So as soon as they're done there, hopefully they'll be in. You're one of the next ones to be seen, okay?
So I just spoke with ortho. There's a few people ahead of you and it's going to be a few hours.
Hello. Hi. We just talked to the neurosurgeons. They're still in the operating room, so it may be a couple more hours, but we'll keep you updated.
All right, I'm gonna get you some Motrin right now. We will get the x-rays in, get you over to x-ray, so get that ball rolling. And it is busy, so hopefully they'll be in as soon as they can. Let me know if you need anything else, all right? Thanks.
A is for active listening. Give the person your full attention. Try to listen without interrupting if you can, and if they give you a complicated story, maybe summarize it so they know that you've understood. Try not to listen like this.
So I was on the bus with my kid, and I pulled him by his arm, and
I'm sorry, one
and
second.
Okay.
I'm sorry. One
Oh.
second.
Okay.
Okay, go ahead.
And then it popped out, and now he's not using it.
I'm so sorry. Can you just repeat the beginning of that?
Here are some examples of good active listening.
So Destiny has had a high fever since yesterday, but she's been coughing since Friday, and she won't drink anything, and she hasn't peed since yesterday.
Okay. So it sounds like Destiny has been having a cough since Friday. She's been having a high fever since yesterday. She's having difficulty drinking anything and is not urinating because of that as well.
A is also for assist. This one is about taking the time, if you can spare it, to go above what is expected and be a little kinder than is necessary, like getting an exhausted parent a cup of coffee, a warm blanket, or a recliner. So maybe not like this.
Excuse me? I've been up all night. It'd be really great. Is it possible for me to get some coffee?
I'm sorry, this is mine. I don't really have time right now. I'll get back to you when I can.
And more like this.
Can I help you find something?
Would you like a blanket?
Sure, thank you.
Oh, it's a warm one.
Oh, thank you so much.
There you go.
Thank you.
How about if I step out and get her some juice?
Okay. So why don't we get her something for her fever? We'll make sure that she's able to eat and drink while she's here, and we'll get her feeling better.
So A is for assist and active listening. R is for rapport building. Try to talk with the patient or family about something that doesn't have to do with their illness to try to make a connection with them.
Oh my gosh, I love those glasses. Where'd you get those frames? I'm always looking for new ones, and I really like the color of yours.
I love that outfit you put on him. He's so cute.
R is also for rest. Sit down with the patients if you can. If you do, they will report a better experience, better understanding of what you're telling them, and they will get the sense that you were in there longer than you were. Like this.
Hi folks, how are you today? My name's Andy, I'm one of the PAs. I'm working with Dr. Fearon. She's the attending doc who's going to be taking care of you guys today. What brings you here today?
Check out the difference between these two perspectives.
Hi, I'm Dr. Hare. I heard you've been having some belly pain. Hi, I'm Dr. Hare. I understand you've been having some belly pain.
E is for empathy. Here's some examples of non-empathic statements. At least it's not the hand you write with. Don't worry, her bicarb is normal. Well, it could be worse. She's fine. And if you can, try to avoid saying, I know exactly how you feel.
So doctor, what do you think is wrong?
Well, we've done all these tests, and you just have to know that they're all normal. There's clearly nothing much wrong with your child. You just need to, hang in there and go see your doctor, because we're just not finding very much here, okay?
Her fever's just really high. I don't know.
I know, but that's not really an emergency to come to the emergency room for this. I mean, that's something you could have just called your pediatrician for. I mean, that's not why we're here.
Here are some examples of empathic statements. I'm so sorry that happened. It's really hard having a sick baby. Oh no, that's terrible. I wish I could do more. And that's very scary.
Her fever's really high. Don't know.
I know, sometimes that can be really scary. They don't look well. I mean, it's always best if you're concerned, bring them to the emergency room. That's why we're here, to check them out to make sure everything's okay.
Are you saying it's just a virus?
I do think it is a virus, but it's really hard having a sick baby.
ICARE is not just for patients. We need to take care of each other.
Hey Nance, I got a few minutes. Do you need some help? You want me to get something?
Yeah, I need about 3 things. Can you help?
Yeah. Oh, honey.
Okay.
I'll get you something.
So ICARE stands for I, introduce, show your eye teeth, and pay attention to eye color. C, communicate what to expect and give updates. A, use active listening and assist. R, rapport building and rest if you can. E is for empathize, acknowledge that it's hard. Thanks so much for watching, and a special thanks to all the amazing actors who made this video possible.